morning, everyone. I'm Cheryl Cohen. I am the hostess, hopefully with the mostest, for this interview with Dr. Andrea Tricco, who is with the SPOR Evidence Alliance, and we are super excited to be here with Andrea this morning as part of our Greek to Street initiative here at KT Canada's annual scientific meeting being held in Vancouver, beautiful Vancouver this year.
Gorgeous.
So welcome, Andrea. We're
Thank
very
you so
happy
much.
you're here. First question is always the most obvious.
Okay.
Tell us a wee bit about yourself.
Okay. So my name is Andrea Tricco.
Yep.
I'm a scientist at the Shing Knowledge Institute of St. Michael's Hospital.
Yep.
And I'm also an associate professor at the Dell Atlantis School of Public Health, University of Toronto.
Great, fantastic. And you seem way too young to be all of those fancy things, but
Well,
we're very lucky to have you here.
Thank you.
Because we're sitting here talking, Andrea,
Absolutely.
and we're at KT Canada's annual scientific meeting,
Yeah.
and the focus, as you know, of this meeting is around knowledge translation and patient engagement in that process. Tell us, in your own words, we've had lots of people come through the interview booth so far over the last 2 days, and they've each had a very unique, given their expertise, view of knowledge translation. What is yours?
So knowledge translation is the process in which we take our research findings and we whittle them down and we create these key messages that are tailored to our knowledge users.
Right.
So when I say knowledge users, I'm talking about patients.
Yeah. Real people?
Real people. So patients, our clinicians, as well as our policymakers are the main buckets of our knowledge users. So we want to make sure,
No, go.
Yeah. So we want to make sure that our research findings are relevant and we're able to translate them to our audience, so to our knowledge users.
In that process of whittling, love that word, it immediately brings an image to mind for me. In the whittling process, is it important to involve all of those different stakeholders you just mentioned who are end users? Do they participate in the whittling process?
So absolutely. So it depends on the type of knowledge translation that you're doing.
Yeah.
And so we try to encourage integrated knowledge translation. So that's when the question actually comes from our knowledge users.
Okay.
And we work with them to co-create a research project. So they're involved in all aspects of the research design and being involved with the whittling down, coming up with the key messages, and actually trying to implement those research findings in practice.
Yeah, and I'm thrilled to hear your answer because we were just in the session, in the plenary talk given by Dr. Nick Bansbeck, who was talking about sort of consumer products, you know, like Apple iPhones or whatever widget you want to name, versus the design and development of research and products used in health.
Yeah.
And there are significant gaps in the health side versus the basic consumer goods side. Yeah. And what is it we can learn from the consumer goods side? So tell us what you think, Andrea, about that. Like, where do you think we need to do more or better on the healthcare side in terms of bringing something, an idea, whether it's a research idea or a product in health? Tell us what you think is missing or what needs to be beefed up.
Yeah, I mean, I'm not sure if it's what's missing, but more what needs to be beefed up.
Okay.
And I'm thinking that we are moving that way. So I think science in the field is moving towards more co-creation, working together, actually getting the research ideas comes from the patients.
Right.
The research idea comes from our knowledge users.
Yeah.
Right. And then figuring out what the needs are, where are the gaps, and then doing research to fill those gaps and working together and co-creating the research together.
So that's actively underway. you guys are looking to the consumer product sort of process and saying, where can we learn from that?
I'm not sure if we're using the consumer process in the way that Dr. Bansbach was talking about it today. I think we have a lot of learnings and a lot of way to go.
Yeah.
But in terms of this concept of co-creation, where we're working with our knowledge users to produce research. So as scientists and as researchers, we follow the money, right? So we all, right?
So do consumer products, actually.
Exactly. So the Canadian Institutes of Health Research has been putting a strong focus on knowledge users and making sure our research is very relevant to our knowledge users.
Which is fantastic, and the brilliant segue to ask you, okay, so the CIHR is putting its money where its mouth is.
Yes.
And I know, because I'm involved with the Alliance. Yay!
I know, we're so happy to have you.
Well, I'm absolutely thrilled to be involved with such experts in the field, and I'm learning so much already by being a part of the SPOR Evidence Alliance. Tell us what the SPOR Evidence Alliance is, because it was a successfully proposed project, if you will, to CIHR, and you were awarded a significant amount of money to get this Evidence Alliance up and running. So tell us what it is and what you hope it's going to do for Canadians.
Okay, fantastic. So SPOR stands for the Strategic Patient-Oriented Research.
Right.
And so we have this Evidence Alliance. And basically it's a network of about 200 people across Canada. And the people that are involved are researchers, patients. We also have policymakers and clinicians. And our sole purpose, or one of our main purposes, is to respond to our knowledge users through knowledge synthesis, which is doing reviews and looking at what the research says, clinical practice guidelines, right, as well as knowledge translation.
Okay.
So we accept questions that come from a patient, it can come from a clinician, it can come from a policymaker, and we want to do co-creation of knowledge synthesis, knowledge translation, as well as clinical practice guidelines.
So tell me, how is the Evidence Alliance, SPOR Evidence Alliance, making life different than it was before it got funded?
Yes, so we are trying to have a national coordination.
Okay.
So for example, let's say the BC Ministry of Health is really interested in a specific topic, and they need to make a decision in 3 months. So they commission us to do a systematic review, as an example, which is where we look at the literature and we analyze it. We let them know whether this drug is effective or not, right? So one really cool thing is that we, through our whole alliance, we kind of advertise that this topic is going on, and are there other knowledge users who would be interested in this topic. So I'm sure that the Ontario Ministry of Health might be interested as well.
Well, we'll see.
Right, and perhaps they want to tack on a few questions to make it a bit more pan-Canadian and more relevant and more useful to more knowledge users. Also, we include patients in the process.
So I'm going to stop you there and ask, where do patients live in the Evidence Alliance? So you obviously, a network that's as broad, as big as you've just told us about, has to have a governance structure and an operational structure. So for our audience who are made up of patients, where do we fit in? Where do we live in that org chart?
Absolutely. So we have strategically included our patients as partners, and it's a real partnership. And so we have membership on our various committees for governance. Over 30% of the membership is comprised of patients. And we also have committees that are co-chaired by patients as well. We do.
Yes, right? I know that. She's looking at me because I'm one of the co-chairs of the, and feeling the heat to get something done quickly.
No, you're doing fantastic. Fantastic.
So I think one of the reasons for myself, I've been around a long time. I get asked to do a lot of things, good, bad, or indifferent. I have to choose among them because my time is finite.
Absolutely.
And when I saw the SPOR Evidence Alliance proposal, I certainly could see the tremendous value. I saw that the level of patient engagement was going to really smash tokenism, which is important to me.
Absolutely.
That if we aren't enjoying the same levels of power that you are, Andrea, then I think there's something wrong with the model.
Absolutely.
Yeah, so I just wanted to commend you on your colleagues at the scientific end, because doing things differently is not easy, and it takes bravery, and there's a price for bravery, actually.
I agree.
You sometimes take heat from your colleagues, from patients, from government.
Absolutely.
But if the intent to do good and the strategy is really sound, and you have a really firm, what I call backbone, which is your set of guiding principles, you will win at the end of the day. So I really commend you on this effort. I know you and your colleague in this big endeavor, Dr. Sharon Strauss, whom we hope to interview today, but is just flying in.
I know.
So we may miss her, but so you're acting as both people right now.
I will try my best.
Yeah, exactly. I guess in just wrapping up, what do you want to say to our audience about the Evidence Alliance? Like, what's going to happen? Where do you see us being in 6 months or 12 months? Let's talk about a bite-sized piece of work rather than the whole enchilada. How's that?
Yeah, I mean, I think it would be fantastic to have more patients involved with the Alliance. We're providing capacity building opportunities, so online courses. We'd love to co-teach those and co-develop those with patients.
Okay.
We need more patients in our governance structure.
Okay.
We want patients.
Who do people contact? Should they contact ACE and then we pass them to you, or can they go to you directly if they're interested?
So we do have a website. So if you type in SPOR Evidence Alliance into Google, it should pop up.
SPOR Evidence Alliance. Okay.
Yes. But if people want to come to you, that's absolutely
as long as we get them to you, then you can try to find a way to stream them in.
Absolutely.
Okay.
Yes.
Fantastic.
Yeah.
So more patients, and I guess at the end of the day, you're producing products for clients.
Absolutely.
Yeah.
That's what it's all about.
So you hope to in the next 6 to 12 months. Do you guys have you set an objective? We want to have done 12 reviews. We want to have seen X policy
changes,
at least influenced by the work that you're doing for the better. Are those maybe some of the metrics that you're using?
Absolutely. So we do have a full evaluation strategy for the Alliance. Okay. But in terms of the number of projects, we're aiming for about 100 over the 5 to 6 year grant.
Whoa.
Yes.
Okay.
So we like to aim very high.
Yeah, no kidding. I can see we're going to be busy.
Yeah, we're going to be very busy, but it's going to be a lot of fun. Yeah. And it's a real pleasure to have you and fantastic people like you. And, it's a great group, and we really have a growth mindset. Yeah. And we're here to learn from you and work together.
Well, I think that's the whole idea about co-creation, is it is a learning process, and it's 360, right? Everybody sometimes fumbles around in the dark to find the answer, but if you're doing it with other people that respect you, and you can learn from them, you'll get there in the end, is my motto anyway.
I agree.
Great. Thank you so much, Andrea, for coming in. We appreciate it.
Much.
Thank you for tuning in, and stay tuned for our next interview.